Hi, everybody. My name is Heather Stafford. I'm the Director of Student Health Services, and today I'm going to talk to you about travel health. And in the world of COVID, there's a lot of information to share. So I am going to record this with a PowerPoint presentation, and then there's also some handouts that we have on our website for you to view as you're watching this presentation. So when we're talking about travel health, we want to make sure that we're giving you the most updated information. And a lot of these ideas that I am sharing with you can be found on the internet as far as the different sites that have to do with travel health as well. So we want to make sure that you're being proactive in your trip, that you're prepared for any sort of health issues that may come up, and that you're protecting yourself as much as possible. So when you're being proactive, the best thing to do is to research the area that you're going to. When you're overseas, a lot of times when students are studying abroad or traveling, they are not just staying in the country that they have departed to. They are traveling to different parts of Europe, for example, or maybe they're going to different areas in Asia. The best thing to do is to make sure you're documenting all of the different countries that you could potentially be going to, and that you are aware of all of the different travel restrictions and requirements that have been put in place. Make sure you are aware of the date of your departure, the length of your stay, and the date of your return. For example, the CDC and the United States government has put into place new travel restrictions when you re-enter the United States, and that was effective as of November 5th, starting November 8th. And so that's how quickly things can change, making sure that you're constantly updating yourself on those travel requirements. The purpose of your travel. Some people are traveling for maybe missionary work. They're going to be building houses, or maybe they're going to a university in an urban setting. There's really not a chance of injuring yourself. And if you're going to do this missionary work, it's important to know what kind of work you're going to be doing. Building houses and things like that can expose you to rusty nails. So we would encourage tetanus, diphtheria vaccinations to be updated. So it's really important to know maybe the specifics of your travel. And like I said, if you're visiting other countries while you're abroad, making sure you understand those requirements. And always staying up to date on the COVID vaccination requirements. Researching your travel needs to involve not just the country, but the specific airlines that you're using to travel, making sure that you understand that there may be requirements for wearing masks, providing proof of your vaccination, testing for COVID requirements, and then what type of quarantine may be involved when you arrive in your country. Requirements are always different from the United States requirements and vary by country. So making sure that you don't get yourself into a position where you're denied entry into that country if you have not made sure that you have followed all the different requirements. You need to make sure that if that country that you're going to has COVID-19 vaccine requirements, that you have not only proof of that in a hard copy document, but also taking a picture and putting it on your phone, putting it in your Apple Wallet, whatever that may be. And then you're investigating what type of COVID-19 testing is required to get onto that airline or to get into that country. That's really important that you're paying attention to the guidelines of the testing dates and what is acceptable before you enter the country. Being proactive also means that you're going to these international travel sites and making sure you're up to date for the testing requirements. This is a really good one. This is the CDC vaccination travel requirements for international travel, making sure that you're checking all your destinations like we have previously discussed. If you would like to get a better understanding of the different requirements, travel health appointments can be made at Student Health Services. We usually encourage you plan well ahead of time. So if you're leaving for January, we hope you've already made your travel health appointment at Student Health. Bring your vaccine record with you to your appointment. Provide a list of your medications, both prescription and over the counter, and we'll talk about why in a minute. Provide a list of all of your allergies, list of chronic medical conditions. There is a cost to all appointments here at Student Health. But specifically, I want to make sure you're aware of the My Shocker Health portal. This will be extremely advantageous to you to know how to log into this portal while you're overseas, not only so that you can view your vaccination requirements if you submitted them to student health. You may see your COVID-19 vaccines there that can be easily printed off. Or if you need to contact one of our healthcare providers based upon a health issue you may be having overseas, you can instant message at any time of day. And then as soon as we are back in the clinic, we can respond to you. Make sure you're monitoring your health before you leave. Maybe it's a good idea to wear a mask 14 days before you're ready to leave to reduce your limitation to exposure to COVID-19. Remember that a lot of times there is a chance of having a breakthrough exposure. Breakthrough exposure would mean you are fully vaccinated to COVID-19, but you are potentially testing positive due to symptoms and exposure. So making sure that you're protecting yourself before you leave, and then monitoring yourself. Do you have a fever? Do you have a cough? Sometimes airlines are still monitoring temperature checks. So making sure that you have monitored yourself before you get to that airport. If you have tested positive for COVID-19, do not go to the airport and get on that plane. Make sure you put yourself into isolation, and then you contact the airline to see what you can do for a voucher for a later date of travel. What to do in each of those situations is really important. And so if you have any questions at all, if you test positive before your trip, give us a call at Student Health Services so that we can help you as to what to do. And then also making sure, do you have any special health needs before you travel? Do you have difficulty with ambulation? Maybe you need some sort of walking aid. Do you have trouble with special medications that you may have? Maybe it's an injectable. Maybe you have chronic medications that you take, like diabetes medications, and you have to have needles, you have to have all of that medication. You want to consider, okay, do I really want to put this in my checked luggage, or do I want to put that in a carry-on, and what that looks like going through security? You need to make sure you're getting onto each airline's sites and looking at that information. Make sure you pack really smart. If it's medication that you take daily, or if it's medication that you need immediately, let's say you have asthma, make sure that you pack yourself an inhaler, not only in your checked luggage, but in your carry-on luggage as well. Making sure that you have a list of all your prescription medicine and your over-the-counter medicine, not just in your phone, but in a hard copy put in with your luggage as well. All of your prescriptions need to be in their original containers that have the dosage, the prescription by what physician, and then what that particular medication is for. You should be well aware of that. Having a hard copy and a picture of your vaccination record that includes your COVID-19 vaccines. Putting your primary health care information in your phone, your physician that you see, if that's Student Health Services, put that information in your phone, or if it's your regular primary care physician that you see off campus, put that in your phone as well. Always, always carry an extra pair of prescription glasses or contact lenses, and always have a printed out copy of what your prescription looks like. You can get that from your opticology office and our optometrist office, and make sure that you have different glasses and contact lenses in checked luggage and your carry-on luggage, so that you have spares. We have had numerous instances of students who have contacted us trying to get their prescription for their glasses, and that's really difficult when you're overseas. If you have a chronic illness, let's say maybe you have epilepsy, make sure you have a medical ID bracelet on. Being aware of your food and environmental allergies, and notifying your roommates, host families, and friends that you have developed overseas, so that, let's say maybe you have a shellfish allergy and you're in Europe or Asia where fish and different seafood is very common. You want to make sure that you are aware of your shellfish allergy, that if you need to, carry an EpiPen with you on your trip and be ready for any of those instances where it is not marked that shellfish is in the foods. Be aware of your health insurance, and if you have a health insurance, get a copy of your card. A lot of universities overseas may require you to have health insurance, and that not only you have health insurance, but you have a specific requirement for the coverage of your health insurance. It's usually a very robust plan that will cover you for any illnesses or injuries while you're overseas. So what do you do if you get sick while you're on your trip? And this is very common. So you want to make sure that you are aware in that vicinity that you are in. Let's say you're traveling to Japan, what type of healthcare facilities are in that location? Maybe your university has a student health. Chances of that might be pretty slim if it's in an urban setting, but maybe making sure that you know of healthcare facilities. Know the U.S. embassy and consulates that are in your area or your country that you have departed to, and that you find the information on there of where to seek health care. And then always put in your cell phone your ICE contact. ICE is in case of emergency contact, and not just have one. Make sure you have a couple people that somebody could get a hold of in case of an emergency and find that information on your phone. You want to make sure that you let people know in your emergency contacts if you're going to be traveling within that region. So let's say you're going over to Germany, but you decided that you're going to take a trip and go to France and England for a few days. Making sure you tell your family, this is my departure date, this is when I'm returning back to Germany, just so that they are aware of your travel arrangements. Always pay attention to your health during your trip. And it's really important to know the activities that you're going to do. Maybe making sure you're constantly using sunscreen, or maybe an insect repellent is required in that region. Being careful to consume certain foods, certain countries, maybe you may not want to drink tap water, and maybe make sure you have bottled water. Washing your hands often with soap and clean water, always carrying hand sanitizer with you. Keeping your feet clean and dry, never going barefoot. Don't handle animals, limit your alcohol intake. That's extremely important. Avoiding travel at night, and never travel alone. Always travel with a buddy so that you have somebody who will help you in a situation. Use caution when swimming or different water activities. Wearing protective gear when you're doing adventure or different type of exciting activities. Using condoms, making sure that anytime you're having a sexual encounter, you use a condom. Get plenty of rest, and then respect your host country by paying attention to its laws and customs, not just for just regular day, but also with healthcare and health activities. So then you've had a great time at your destination, and it's time to get ready to prepare for coming back to the United States. Earlier, I had mentioned that there are new requirements for reentry, making sure that, maybe you're there for the entire semester at your university so that you're prepared, at least a month ahead of time what that looks like. And things change all the time due to COVID-19. So this is a great site that you can look at for requirement for proof of a negative test or documentation of recovery from COVID-19. What to do if you're vaccinated, fully vaccinated, or not vaccinated, and what the testing obligations look like. There's also a handout that we have on our website, and that I'm going to provide to your instructor if you are in a class getting ready to do study abroad, so that you have the most updated information. And then once you do arrive back inside the United States, monitor your health again. Sometimes when you're coming from a specific region or a specific country, especially the state of Kansas Department of Health and Environment has certain quarantine requirements for countries. And you could find that information on the COVID-19 page on the WSU website. If you're not feeling well when you return home, you should see a doctor and mention that you have recently traveled. A fever and a cough should be evaluated immediately. If you are in a particular region where malaria is common, malaria is serious. It's not just a one-time thing. Sometimes you can become ill with a fever or a flu-like illness, and you become sick with that maybe sometimes up to a year after you come home. We encourage you to schedule a tuberculosis skin test before you depart and 3 months after you return. This is very important if you are going to be studying abroad and staying for a significant period of time in your host country. That would be 3 months or longer. So we want to make sure you test for tuberculosis before you leave and test when you return to the United States. And this is more specific for countries who have a high risk of tuberculosis. This would be all of your Asia countries, maybe not so much your Western European countries. Complete any immunization series. Let's say before you left, you started the hepatitis A vaccination series. Hepatitis A is the one that the vaccine that protects you from a lot of your foodborne illnesses, protects you from the diarrhea and vomiting that may occur when you're exposed to some foodborne illnesses. And hepatitis A is a 2-shot series. So let's say you got your vaccination in October of 2021. You need to have the second one 6 months later. So making sure that if you didn't get that second hepatitis vaccine, that you get that as soon as you return to the United States. And don't forget to check your COVID-19 requirements. This is a really good site here after arrival in the United States, some things to do. After you return, you may want to go ahead and get tested again 3 to 5 days after you return, monitoring yourself for COVID-19 symptoms. And that looks a lot like what influenza respiratory flu looks like. It looks a lot like cold. It looks a lot like allergies. So if you're having congestion, stuffy nose, fever, cough, chills, body aches, you need to test for COVID. Especially if you're not fully vaccinated, you should test for COVID upon return, but I would also encourage you to go ahead and test if you are fully vaccinated. And then don't forget, COVID testing is available, and so are COVID vaccinations through Student Health Services on the WSU campus. So just a reminder, Student Health Services is located in the Steve Clark YMCA and Student Wellness Center on campus. We're available Monday through Friday, 8 to 5. You can see our phone number on the bottom of the screen. Any important new information about COVID testing and vaccinations can be found on the wichita.edu COVID-19 site. And if you have any questions at all, feel free to call us at 316-978-4792, or you could also secure message us through the MyShocker portal. And you can get to the MyShocker Health portal through our website at www.wichita.edu/SHS. So we just want you to be safe. We want to make sure that you have the most updated information. If you have any questions, feel free to reach out to Ann or myself, and we can get you in contact with what you need to know. Good luck and have a safe